Welcome to our channel, where we explore cutting-edge topics in healthcare. Today, we delve into a critical issue that affects millions globally: malnutrition and undernutrition. From pediatric wards to geriatric clinics, understanding these terms is crucial for every healthcare professional. Malnutrition isn't just about hunger. It's a complex interplay of dietary deficiencies, metabolic imbalances, and socioeconomic factors. In today's fast-paced world, where processed foods dominate, ensuring optimal nutrition has never been more challenging. Now, let's break it down. Undernutrition refers to inadequate intake of essential nutrients, often leading to stunted growth, weakened immune systems, and cognitive impairments, especially prevalent in vulnerable populations like children and the elderly. Meanwhile, malnutrition encompasses both undernutrition and overnutrition, where dietary imbalance contributes to obesity, diabetes, and other chronic diseases. In healthcare settings, recognizing and addressing these conditions early is paramount to improving patient outcomes. As healthcare professionals, our role extends beyond diagnosis to holistic treatment approaches. Integrating nutrition into patient care plans not only enhances recovery, but also prevents future complications, promoting long-term health and wellness. From dietitians crafting personalized meal plans to pharmacists optimizing nutrient supplementation, collaboration across disciplines is key. Together, we can tackle malnutrition's multifaceted challenges and pave the way for healthier communities. Thank you for joining us on this journey through malnutrition and undernutrition. Stay informed, stay empowered, and together, let's shape a healthier future for all. Call to action with links to subscribe, follow on social media, and explore related content. Join the conversation. Subscribe for more insights.